questions. The same test which you guys gave on Saturday, a few days back. Hello everyone, this is Dr. Aman Sachdev, the Faculty of Orthodontics and DB NCI MDS experts. I hope you all are enjoying the lockdown and also you are studying just a little bit. Today I'm going to discuss the orthodontics image-based questions, the same test which you guys gave on Saturday, a few days back. I'm sure you must not be knowing many of these images. I hope you all did. You were able to recognize most of the images. If not, see, all these images have been taken from Profit and Kharbanda. They are all clinical based. You should know these. You should know the instruments. You should know the appliances, because they will ask you direct questions. They can directly ask you like identify the image, or they can ask you some particular part of that image. So you should know everything, all of this in detail. So let's start from the first question. So this was the first question. You have to identify the appliance. Now see, let us assume you don't know anything about this appliance, right? Now what can you see in this image? There's a lower second molar tube. There's some upper appliance from molar to canine, and the main thing in this is the class 2 elastic. See, the class 2 elastic is from the upper canine to the lower molar, lower second molar. The direction of force of class 2 elastic on maxilla is distal. It always applies a distal force on maxilla, and it applies a mesial force on the mandible. So to prevent the mesial movement of the mandibular molar and the extrusion of the mandibular molar because of this class 2 elastic, we are given a transparent splint. You can see there's a sheet, transparent sheet is there, which is covering all the teeth, including the upper portion of the second molar. So it will prevent the supraeruption and the mesial movement of the second molar. Taking support of the lower arch, we are distally pulling the maxillary molar. This is a distalizing appliance, it's a distalizer. So, and the name of this appliance is carrier appliance. So carrier is a distalization appliance along with pendulum. In carrier, the main thing you have to see is there's a class 2 elastic, and that class 2 elastic is being given from the second molar. Moving on to second question. See, here you have to identify again the appliance. There's some wire component lingually and labially. It is not continuous. It is in two parts. One wire is this, one wire is this. Same kind of wire is on the labial aspect, and it is being covered by a sheet, transparent sheet. This is a retainer, but it is also applying force. This force is applied to correct the mild irregularity which is still left because we did early debonding. Patient wanted to get the braces removed maybe 2 months earlier. Still some amount of irregularity was there, maybe on 1 or 2 teeth. So this helps in correcting the mild irregularity. These lingual wires, they apply labial force. The labial wires, they apply lingual force. And if the teeth are slightly irregular, because of that pressure, they will align. Okay. This is called as a clip-on retainer because it will fit in like a clip. You have to apply slight amount of force, and after the irregularity has been corrected, then it will become passive. Now, see in this question, what all you can see. First thing you can see is this long wire. Okay. Now, why is there a long wire in orthodontics? If you remember my lectures, you have to remember one thing, that force is inversely, it is directly proportional to the diameter and inversely proportional to the cube of plane. Whenever you increase the length of the wire, amount of force will decrease. If you increase the length of the wire 2 times, the amount of force will decrease by 8 times. So over here, you can see there's a long span of wire. Okay, which type of tooth movement requires very low amount of force? Intrusion. If you see this wire is above the teeth, it has been forcibly bent down. It has been connected to this wire which is connecting the upper 2 central incisors, and it is applying a intrusive force on those upper 2 central incisors. So it is a intrusion arch. It is taking these 2 central incisors and pulling them up. This is a intrusion arch. It is used to intrude the 2 central incisors. It is given in deep bite cases, as you all can see. Compared to the lateral incisors, there is deep bite in the central incisors. So it's a very good wire to be given in that region. Now come to this question. Again, very simple. You just imagine, what are these wires doing? These wires are on the labial surface of the teeth. They are applying some kind of force onto the labial surface of the incisors, but you can see closely that they are slightly bent near the cervical area of the tooth. So the most of the force they are applying is on the cervical area of the tooth. Now imagine this is the incisor. This is the torquing spring. Okay, this is the spring. This is applying force here on the cervical area. So what will it do? It will move the tooth like this. Okay? It will apply a lingual root torque onto these incisors. That is, it will move the root of the incisors lingually. So this is a torquing spring. It is not moving the whole teeth like this. It is just moving the roots lingually. This is the portion which is applying the force. So this is a torquing spring. It is usually given in BEGs. If you remember, there were 3 broad categories of fixed appliances: edgewise, straight wire appliance, and BEG. So this is usually given in BEG. Now here in the 5th question, see, this is some kind of a software. I'm sure you must have heard of Invisalign or clear aligners. They are transparent, clear trays which are given in sequences, and they move the teeth. So how do we fabricate these in clear trays? They are fabricated with the help of 3D printing. For 3D printing, you need to have a software. In that software, first we diagnose how much we want to move certainly. We want to move them up, down, left, right. And in those software, we also add composite blocks, because these are the attachments. These will be the composite blocks which will be given on. They will be fixed onto the incisors or canine on whichever teeth you want. Like over here, we have decided we'll place the composite blocks on incisor, lateral, lower left lateral. So this software is called ClinCheck. It is usually with Invisalign. These blocks are composite attachments. So the answer for this question should be all the above. It's a software. These blocks are composite attachments. Okay. So this has to be all the above, and this is used with Invisalign. Now, see this. Here you can see some kind of functional appliances there. It resembles Frankel appliance to an extent. It is having one buccal shield. There's no buccal shield on the other side. So this is a hybrid functional appliance. What do we mean by hybrid? It is given usually in syndromic patients. Like for example, the patient is having hemifacial micromathy. One side of the face is small. We want to expand only one side of the face. We want to move the dentition only on one side. So we'll give this kind of hybrid appliance. It will be a mixture. Here you can see we have given buccal shield over here. So it will be used to expand the buccal side. Only on the left side, we have kept some gap here. So only extrusion of these teeth are allowed. No extrusion of the opposite side is allowed. So this is a hybrid functional appliance, and it is usually given in syndromic patients. Now again, this is also a very good appliance. See, just imagine there's a loop. Okay, these are the two arms of the loop. If we try to open, it will apply mesial force on the premolar, distal force on the molar. So this is a distalizing appliance again. It is used for distalization. To prevent the mesial movement of the premolars, we usually give some kind of anchorage in the premolar, like either we'll give Nance button on the palatal aspect. So here what will happen is, once these loops will try to open, they will push the molar distally. Now if you tilt your head and look at the image like this, see, it resembles a K, right? So that's why it is called a K loop distalizing appliance. Clear? This is a distalizing appliance, and because of the shape, it's called as K loop. So it's a simple distalizing appliance. So in this, till now, you have also read about the first one, which was a distalizer. Then here you have seen the K loop distalizing appliance. Okay. Now, see, imagine these two molars. You have placed a straight wire which is connecting these two molars. Now suddenly you are given one small V bend. There's a small V bend between these two wires. So what will happen is, the two molars are like this. When you give this bend, it will try to move the teeth like this. Okay, it will move the teeth like this. So here you have seen that here's a counter movement. So just a direction of movement. Okay. So what they have asked is, what will be the direction of movement on the tooth with this V bend? So here is counterclockwise, here it is clockwise. Whenever you give a V bend at the center between the two teeth, there will be equal and opposite movement. One side clockwise, one side counterclockwise. And if you try to move this V bend towards one tooth, if you move it towards one tooth, then what will happen? The movement will increase, and on the opposite tooth will become 0, because we have moved a bit far from that tooth. And once you move the V bend 1/6 towards one tooth, 1/6, then the direction of movement will become same. Okay? When you keep the V bend at center, equal and opposite, you shift it 1/3 towards one tooth, that side increase, opposite side 0. You shift it more, both sides will become same. Okay? Now here also you have to identify the bend. This bend is given between two incisors. Now see, you can easily see this is a step bend. Okay? When you give a step bend is also a type of first order bend. So here the answer should actually be D. It's a step bend. It moves one tooth slightly incisally, one tooth slightly gingivally. And if you remember the first order, second order, third order bends, first order bend was a up down bend, also in out bend. So here, because this is an up down bend, it is also a first order bend, and it is also a step bend. So the answer here should be D. Both B and C. It has been incorrectly marked as B, but it should be D. Okay. Now come to the next question. See here again, you have to identify. You just see this pocket, bacillary tube, and small part into the mandibular band. So what happens is, this portion will and it will prevent the when the patient closes his mouth, he will be forced to bring the mandible forward so that the mouth can close because of these structures. This is a fixed function appliance which moves the mandible forward, and the name of this appliance is mandibular anterior repositioning appliance. It is also called as MALAP. Okay, mandibular anterior repositioning appliance. Again, this is also a type of fixed functional appliance. I'm sure you must have heard of Jasper jumper. That was a fixed functional appliance. It's slightly similar to that, but not completely similar. It is called as a clapper super spring. For the difference, see, Jasper spring, Jasper jumper, the attachment is not like this. It is going from and coming out from the mesial aspect of tube, moving distally, and then it is placed on mandibular canal. Jasper jumper has a tubing. It is usually placed on the mesial side of the upper molar tube. This is a Klapper super spray. Again, this image has been taken from Utika Ganda. Now, if you remember the contributions of angle, angle gave 4 appliances: E-arch, pin and tube, ribbon arch, edgewise. You can see this image is very old, and this is a ribbon arch appliance. Ribbon arch appliance and Beck bracket. Ribbon arch bracket and Beck bracket are same. If you look closely, these are all Beck brackets. But in Beck, the slot was facing gingivally. Here the slots are facing incisally, and it is not Beck's. Why it is not Beck? Because Beck came much later as compared to angle. In Beck, you directly bond the bracket onto the surface of the tooth usually, but here you can see all the teeth are banded. So this is a ribbon arch appliance. In Beck also we can band the teeth. We can also band the teeth and build the bracket onto the band, but this is a very old technique, and earliest technique was ribbon arch. Again, contribution of angle. Here you can see these pins. These are the pins. These pins go into tube, so that's why this is pin and tube appliance. These all appliances are given by angle. These 2 appliances not used anymore. Now, whenever we do bonding of the brackets in orthodontics, whenever we start the treatment, we need to have complete isolation, good etching, good isolation. Only then we can achieve good etching and good bonding. So to help in that, we need this. This is a cheek retractor with 2 suction tubes, continuously ejecting the saliva. There's a Vishnu here which is preventing the tongue from coming forward. This is called as Nola's dry field system because it will keep the field of view dry. This helps during orthodontic bonding. This is CVMI stages, I'm sure you must have seen them. But the ones which are studied in Balaji, those are given by Hassel and Farman. Okay, these are not given by Hassel and Farman. These are, if you look closely here, what is this 2 year, 1 year, less than 1 year? If you remember my lecture, I've explained you these stages where the peak growth velocity, peak height velocity is still nearly 2 years away, 1 year away, less than 1 year away. These are these stages. They were given by McNamara and Bassetti. So this is taken from Profit. This is the latest CVMI which you have to remember. Okay, not the one of Hassel and Farman. Now this is a hand radiograph. Here, hand radiograph is also taken to check the cell maturity index. In which growth stage the patient is there. Now I have asked you to identify this bone. This bone. Same hand, there are 8 bones. There are 8 wrist bones. The 4 they are called as distal bones. These are called as proximal bones. जो पास है body के, these are proximal. जो दूर है, they are distal. Okay. So if you start from the thumb, okay, just imagine this. You start from the thumb. 1, 2, 3, 4. Okay. You have to move this side from here to here. I've asked the first one. This first one is medium. Second, trapezoid. Capitate. Fourth, okay. I have placed the options in order. Trapezium, trapezoid, capitate, hamate. And these are the distal bones. The proximal bones, you see this, again you have to move from here. First one is the lunate, biquetral, and then distal. These are in order. So the total 8 bones are these. They can ask you any of the bone. You should know that. You have studied anatomy also in the first year. But you should know what's relevant to orthodontics. This is relevant to dentistry. This is relevant to know when the growth spurt of the patient is likely to come. Okay? These. Now, these are all appliances which are used in fixed orthodontics. So here, this is a small attachment. Whenever you see a small round base, this is bonded onto the tooth. This is something small which is used to rotate the teeth. You can attach elastics, you can attach keychains onto this arm or this arm. This is called as lingual cleat. Lingual button will be like a button. जो कुर्ते में button होता है, those kurta small buttons. Lingual button is exactly like that. Lingual tube should be hollow. It is not hollow. And lock pin is used in bed. It is completely different. This is a lingual cleat. It is used to correct rotations of the teeth. We can attach elastics or keychain. Now you have to identify this auxiliary. See what happens is, first you have to see the bracket. Can you identify this bracket? This is a Beck bracket, again like the ribbon arch bracket. So what happens is, in Beck, it's not a rectangular slot like edgewise. Here the movement is a single contact movement. The wire contacts the bracket at single point usually. It's not 2-point contact. So the bodily control of the tooth is very difficult. We majorly achieve tipping movements of the teeth. So to correct the root positioning of the teeth, we use certain auxiliaries. First auxiliary we use was torquing auxiliary. That torquing auxiliary is also used in Beck, and this. This is an uplighting spring. So imagine your tooth is tilted mesially, like you have moved the tooth, you move the canine, but the root is mesially or distally. Now you have to uplight it. If the root is mesially, you have to move it slightly distally to uplight it. For that, you have to give this kind of spring. This spring goes into the bracket. It is attached here. So taking the support of this wire, it will move the root like this. The spring will move the tooth like this. This is a uplighting spring. Remember, spring, the coil is vertical, right? So it will move the tooth like this. If you place this coil not like vertical, horizontal. If the coil is horizontal, then it will move the tooth like this. So when the coil is horizontal, it becomes a rotating spring. If the coil is vertical, it moves the tooth like this. It becomes an uprighting spring. This is used in pain. What is this? This is mandibular nerve, lingual branch. You have to identify this main thing. Okay, you can see it is from growth and development. It is the cartilage. It is the Meckel's cartilage. Now, Meckel's cartilage is a cartilage of the first pharyngeal arch, and it helps in the. It not directly helps, but it provides a platform where the mandibular ossification happens. Around this, the mandible is formed, and this cartilage. There are two parts. The otic capsule to the symphysis. This is Meckel's cartilage. You have to remember the remnants of this Meckel's cartilage also. It can come as a question, not image based, but direct question. Now here you have to identify this line A, this red line. Now these lines are depicting the forces, direction of the movement of the masticatory forces or the stress lines. If you remember Wolff's law explained to us the directions of the trajectories of force. So this first line, it is a frontonasal buttress in Wolff's law. The blue one zygomatic, and the blue one zygomatic, and this one it is the pterygoid buttress. These are the horizontal buttresses. Okay, in maxilla and mandible. So this one is frontonasal, zygomatic, pterygoid. Wolff's law. Okay, remember that. Here you have to identify the functional appliance. Remember that. Here you have to identify the functional appliance. It should be pretty easy for you now. What is this? It is similar to activator. It is not activator. Activator consists of only one wire. Consists of two wires, one here and one here. It is the bionator. Okay, given by Walters. This is the palatal loop. Helps in positioning of the tongue. This helps to keep the cheeks away. Bionator. Okay. In activator, the palate also there is no wire, and the full palate is covered with acrylic. Again, this is similar to that first question, that hybrid functional appliance. This is a Frankel appliance. Should be pretty easy for you. They can also ask you which kind of Frankel appliance. Okay, here for identifying the type of Frankel, you need to know that there are lip pads, type of lip bumper in Frankel. If the lip pad are given in upper, it means you want to move the upper arch forward. So this is FR3. If it is lower, then it can be FR1 or FR2. Here you can see the lip pads are in the mandibular, not in the maxilla. So it is either FR1 or FR2. Now you have to identify this. This is again clear, but it is not transparent. It is made up of a very thick kind of plastic, thermoplastic sheet. This is a Kessling's tooth positioner. Now tooth positioner is given as a retainer, and it is also used to achieve minor tooth movements. If we want to achieve slight amount of tooth movements after debonding of the brackets, then we give tooth positioner because it repositions the teeth into more better contacts. Invisalign clear aligner SS retainer, they will be completely transparent. This is not transparent, and they will be thin. This is thick. Now you have to identify these space maintainers. Simple, there's band and there's loop. This is band and loop. It is given when there's early shedding of D, you can give simple band and loop on E so that it maintains the space of D. Okay, crown and loop, instead of band, there will be crown. In distal shoe, there's no such kind of loops. Now this is a distal shoe. This is the band given on D. Now distal shoe is given when there's early shedding of E, and you don't want that the first permanent molar to erupt into the position of the second premolar. You don't want that space loss. So this guides the eruption of the molar in this area and maintains the space of the unerupted second premolar. So this is a distal shoe appliance or distal shoe space maintainer. This part goes into the alveolar socket and it guides the eruption of the molar like this, so that the molar does not go over here. Now this is a very important question. This has been asked earlier in last year NEET. See, we have seen we have extracted premolar here. Now we want to close this space. How do we close this space? We have taken this elastomeric module. It is a small elastic ring. We have taken a ligature wire, passed through it, and then that module is engaged onto the molar teeth. The ligature wire is connected to the canine bracket, and then we cinch it. We tighten it so that this elastic stretches. So when the elastic stretches, now it will apply force. It will apply a distal force onto the canine, and it will lead to distal movement of canine and closure of this premolar space. So this is an active tieback. This is called as tieback. If the elastic is stretched, it is called as active. If it is not stretched, it is called as passive tieback. Okay. You can also close this space using a closed coil spring, not given here. Closed coil spring is a spring, NiTi spring. You can stretch it from one canine to the molar tube, and then when the spring is stretched, it will close, and then it will bring the canine distally. This is an active tieback. Now, here you have to again identify this. See here, this is an elastic. You can see this is an elastic, and it is covering all the teeth. It consists of holes like this. It's continuous. It is an E chain. Okay, only an E chain is like this, holes which are continuous, connecting with each other. Modules is like that. This is a module in active tieback. This blue color ring is a module. It is a simple round ring. This continuous chain of rings is an E chain. Okay, it is used to close spaces. Like if there's generalized spaces between central and lateral canine, you give this E chain, it will close all the spaces. So here you have to identify what is this, especially this. See, it is attaching somewhere here. You can easily make out that this patient is having an impacted canine. The canine is impacted and it is not able to erupt. Now you want to bring this canine down. What we do is we open the flap or we make a window over here. We bond one bracket or one attachment onto the canine so that we can bring it down. This attachment is usually this gold chain. This is a chain. Attachment is bonded. One end of the chain is bonded onto the canine. Flap is closed, and then that chain is ligated onto this NiTi wire. Okay, so it is very smooth. It does not irritate the chain. So this is a gold chain, and it is used to bring the canine down, impacted canine down. Now these are ceramic brackets. Ceramic brackets. What are ceramic brackets? They are made up of alumina. There are two types of ceramic brackets. Now, alumina particles, a bracket can be made up of either polycrystalline or monocrystalline. Polycrystalline means that there are many crystals, and monocrystalline is that there is a single crystal. So when there are many crystals, the bracket is opaque or translucent. It is opaque, this one. And when it is monocrystalline, single crystal, the microscopic structure of the bracket is made up of a single crystal, then it is a monocrystalline. Because of that single crystal, the bracket is more of like glass. It is much transparent. It is not opaque. So this is a monocrystalline ceramic bracket, and this is a polycrystalline ceramic bracket. Okay, metal brackets are usually made up of stainless steel. Ceramic brackets, alumina, and there are two types: monocrystalline and polycrystalline. Now you have to identify this type of elastic. You have read about class 2 elastics, you have read about class 3 elastics from canine to molar. So it is going from canine, premolar, upper premolar, and lower molar. So when you take one elastic and place it like this, zigzag, this is placed zigzag because you are applying forces on the upper as well as lower teeth. You are bringing them closer to each other. Now because of ortho treatment, there can be some kind of that the bite is not proper. The teeth are not occluding proper. If the teeth are not occluding proper, this slight gap. So what we want to do is we want to bring those teeth closer to each other. So we pull the upper teeth down, lower teeth up, and these are we want to settle the occlusion. So these are called as settling elastics. Okay, because we are settling the occlusion. Class 1 class 3 elastic, upper canine to lower molar, class 3 elastic, upper molar to lower canine. Box elastic given in open wide, all 4 canines. One single elastic given in a box type method. Now here again you have to identify the bracket. This is a self-ligating bracket. There is no module or elastic chain which is covering the bracket. Okay, a module or elastic module or ligature wire. Sorry, module or ligature wire are used to hold the wire inside the bracket. Here you have seen there is a door. This door, we open it, wire, we place the wire, the door is closed. These are self-ligating brackets. I've explained in my lecture. And the name of this bracket is Damon. This is the most common and most famous bracket which we use. It is a Damon bracket. You should remember this shape. You can ask this directly. The smart clip bracket is given by 3M. And instead of a door in the front, there are two small clips on the sides of the bracket which hold the wire. Now, what is the ideal material for this wire? See, what is this wire? This is a bonded lingual retainer. Okay, this bonded lingual retainer, it is given after the orthodontic treatment is done. Now, this retainer ideally should be made up of blue alloy. Nowadays, it is also made up of cross-striated stainless steel wire, which means you take 2 or 3 bands of stainless steel wire and you interwoven them so that they become cross-striated, and then you bond them. Okay, like double stranded or triple stranded, but ideally they should be made up of blue alloy. Question 33. In which sector is this canine impacted? Now, in canine impaction, I explained you sector classification. So what is sector classification? Now, this canine, this is the deciduous canine. This canine had to erupt here, but it is impacted. Now, how do we know it is in which sector? There's a basic classification using this lateral incisor. You divide the lateral incisor into a half using imaginary line. if the canine is impacted mesial to the canine, mesial to the lateral incisor in this area, it is sector 1. Sector 1 means it is closest to its eruption position. Sector 2, if it is overlapping mesial half of the lateral incisor. Sector 3, if it is overlapping the distal half of the lateral incisor. What is overlapping? We have to see the cuspal tip of the canine, not the whole canine. If the cuspal tip of the canine is mesial to the lateral, sector 1. On the mesial half, sector 2. On the distal half, sector 3. Distal to the lateral incisor, sector 4. Okay, so here you can see that the cuspal tip of the canine is completely distal to the lateral incisor. This is the line. I'm sorry, I said reverse. If the cuspal tip of the canine is distal to the lateral incisor, over here it is sector 1. This is sector 2 when it is overlapping the distal half. This is sector 3 when it is overlapping the mesial half. Okay, and this is sector 4 when it is completely mesial to the lateral incisor. Okay, so these are the 4 sectors. When it is across the mesial, when it is across the median line of the lateral incisor, it means it is towards the mesial half of the lateral. Maybe it has even crossed the whole of lateral incisor. It means it is far away from its position where it should have been erupted. So it is much more difficult to bring the canine into the original position. So over here, like this, the cuspal tip is completely mesial to the lateral incisor. Because it is sector 4, it will be very difficult to bring this canine from here to here. So we say it is unfavorable canine impaction. Sector 3 and sector 4 are called unfavorable canine impaction. Sector 1 and sector 2 are called as favorable canine impaction. Okay, so distal to lateral incisor, sector 1. Mesial to lateral incisor, sector 4. You have to check the cuspal tip. Now you have to identify this instrument. Now this is a separator placing plier. See what happens is whenever you start the banding procedure of the molars, before the band can go into the contact points between the molar and the premolar and the molar and the second molar, you have to place separators. This is a separator placing plier. You place a separator over here. You press it, it will open. The separator will stretch. You can insert the separator between the contact point of the molar and the premolar from the 2 teeth which you want, and you remove the plier. This is a separator placing plier, and those separators will create space between the molars and premolar. Then you can place your band. You have to remember this. They have many times asked also instruments in last 2 papers. This question was also asked recently. This is a spot welder. Now, when you attach molar tubes onto the band or some kind of attachments onto the band, you do not solder it. You attach it with the help of a spot welder. This spot welder, it has a cathode and an anode. You place a band and an attachment together between these 2 points, and you press the button. When you press the button, the high voltage electricity passes through them. It melts the tube and the band in that area, and then it cools down, and the joint and at that particular joint, the tube and the band gets attached. So you join these attachments onto the band, passing electricity using spot welder, and where that electricity has passed, that portion melts the metal, and then the 2 parts of the metal they fuse with each other once the metal cools down. Okay, so to attach molar tube, lingual sheath onto the molar band, we have to use this spot welder. Now, this is a sand blaster. What is a sand blaster? Here we fill sand, spot welder. Now, this is a sand blaster. What is a sand blaster? Here we fill sand. Sand is aluminum oxide. It is also called as micro etcher. What is micro etcher? Sand blaster is used to again make the enamel rough. Suppose there's no etchant and you want to make the enamel rough. We fill this bottle with sand, alumina. Using this sand blaster, it blasts the sand with a very high pressure onto the surface, and that surface becomes rough. So it is used to increase the surface area by creating roughness. It can be used directly on enamel as a replacement of etchant. It can be used on some kind of metal, for example, band. You can use sand blaster on band, create some kind of roughness, and then you cement it so that the bond of the cement will be strong. Okay, so this is also used to remove, like when the brackets get debonded and this composite below the bracket is stuck inside the mesh. Use sand blaster to remove that composite. So whenever you want to create roughness, we use sand blaster or micro etcher, one and the same. Now this is an orthodontic instrument. It is called as wingard. See, it is like this. This is a wingard. This is a very common instrument which is used to hold wires. In fixed orthodontics, we don't use universal plier or Adams plier. Okay, this is a wingard. So you see the shape like this. It is used to hold the wires. We take it like this. We hold the wire, insert the wire inside the tube. Whatever. It is a very commonly used plier in fixed orthodontics, and it is used to hold the wire. Okay, this is called as wingard. There's an option A, Della Rosa. Della Rosa is this one. See, this is Della Rosa. It can be easily identified using this. See, you've seen this type of bar. What is this? It keeps the plier open. When I press it, it compresses, and as soon as I leave it, see, it has opened again. So it is like this, and it is having grooves. It is used to make a U-shaped wire. Okay, this is a Della Rosa plier. Now this question has also been asked earlier. This is a tweed ribbon arch plier. Now it is having two flat surfaces which contact with each other, like this, two flat surfaces. Okay, you see it from the side, very thin, two flat surfaces contacting with each other. So what is used is that we use this and we twist the wire. Okay, we use two of them. It is also very commonly given to place bends on the wire. We hold the wire because see, in orthodontics we very commonly use rectangular wire. So when we have flat surfaces, it helps in holding the rectangular or square shaped wire. If there are round surfaces of the plier, it is very difficult to hold a rectangular wire. So we bend the rectangular wire using this tweed ribbon arch plier. Now this is a distal end cutter. When you insert the wire onto the, when you inserted the night or stainless steel wire on the brackets, it is passing through the molar tubes. Some extra wire is there which is passing through the molar tube and it might be pinching the cheeks. So you want to cut that wire. So what we do is, you cannot take a normal cutter and directly take it inside the mouth and just cut it, right? So what we do is we take this distal end cutter. This is a distal end cutter. You see this, it is a cutter, but it is 90-degree bend, right? It is like this. It is 90-degree bend. So we take this cutter, insert it inside the mouth, take it at the back. It will hold the wire and cut it. And a piece of wire will also get stuck inside. We just wire cut. But wire distal the woolen difficult to get great cutter. We need something just not by the bend. This is a distal cutter. This one, press maybe. By the bend. This is a distal cutter. Inside we just wire cut. But wire distal the woolen difficult to get